Welcome to Shape of the City. National statistics indicate that 1 in 6 women will be sexually assaulted in their lifetime, and 1 in 4 women will be a victim of domestic violence in their lifetime. Today we'll talk to representatives from Voices of Hope about what's being done in our community to help these victims. With me are Marcee Metzger, Executive Director, and Morgan Beal, Prevention Specialist. Let's start with Marcee. Hi, how are you?
I'm great. Nice to see you, Clover.
Nice to see you. Now, I understand that Voices of Hope started 40 years ago by some concerned citizens. Tell me why they came together and what services they originally provided.
Well, they came together because there were sexual assaults on the university campus, and it was individual women who wanted to support each other and develop allies to be able to talk to their parents and the police and the administration. It evolved into a crisis line, 24-hour crisis line that was housed at the Women's Center. And because there were so many things happening in the community that were related to rape, they decided to go off the campus and have it at Family Services. So then it was at Family Services for a number of years before it became an independent agency and merged both sexual assault and domestic violence programs.
Okay, very good. Now, besides the crisis line, what other services does Voices of Hope provide today?
We have a continuum of services. We do 24-hour advocacy to the hospitals. We respond 24 hours a day to all the law enforcement. So whether it's police department, state patrol, UNL police, the county sheriff's department, whenever there's an arrest for a violation of protection order or for a domestic assault, our advocates are called and they're able to then make contact before the person is out of jail. We have drop-in services to be able to do safety planning, help people with protection orders, be able to figure out how to talk to other people about what's happening in their lives. We have some short-term counseling. We have many different types of groups. And we also have a prevention and training program.
Okay, now tell me how prevalent domestic violence and sexual assault is in our community today.
Well, I can talk about Voices of Hope. Saw more than 2,000 individuals last year. Adult victims face-to-face, that's their primary issue was one of these things. Domestic violence, sexual assault, could be stalking in a relationship, might have been human trafficking, few gang-related violence. But those 2,000 adults and about 300 children. Of the adults, we saw about 7% that were men. The majority of those who we see are women. We saw some in the adult category that we counted as adults as over 16.
Okay. Now, who are some of your community partners that help you get this work done in our community?
Lincoln is really lucky to have a community that works so well together. We have a battered women's shelter, Friendship Home that we work closely with, Family Violence Council, coordinates with a lot of different programs. We're a part of a community coordinated response that meets regularly with the prosecutors, all law enforcement, the hospitals. We have specific sexual assault response teams that include the hospitals and all law enforcement, our advocates. We work very closely with all of the culture centers here. We work closely with those that are working with substance use and chronic persistent mental health like Centerpoint and St. Monica's. This last year we had 204 memorandums of understanding with departments or programs in Lincoln that spelled out how we would respond and what we would do and what we would maintain in terms of privacy, confidentiality, that our services were free, and then helping all of those organizations that we were working with be able to make a safer referral, know how to respond respectfully, effectively, and understand the dynamics of tactics of control and power and control that are kind of at the root of a lot of the things we respond to.
Now, what can somebody do if they find themselves in a violent relationship?
Well, first off, I really do encourage people to call our crisis line. They don't have to tell anybody who they are. They can walk in. Our services are free, so they don't have to make an appointment to be able to walk in during our open hours. It lists all of our services on our website. I think it's really a helpful thing if somebody is able to go to the website, because we have some discussion about safety planning, what services people have available here, what is shelter, not just our program, but other programs in other communities. But if somebody's in their home and they're experiencing domestic violence, being able to tell somebody is a big deal. I think that having it be so secretive, individuals who use such tactics of control, the person who's experiencing it knows and should be able to trust their instincts about what's safe, know that there are services and people who will maintain very rigidly the confidentiality if they share their stories in our agency and with Friendship Home.
Very good. Now let's switch gears and talk to Morgan. Tell me about your role as prevention specialist.
Sure. Well, Marcee just listed a lot of the important and necessary intervention services that we provide in the community, but my role as the prevention specialist is to really work on how do we prevent relationship and sexual violence from occurring in the first place. So I work very frequently with students at the middle school, the high school level, and even college-age students about topics relating to healthy relationships, healthy and respectful conflict resolution. At UNL, I work a lot around what does consent look like, what is bystander intervention, how do we intervene in these situations where maybe we're not the perpetrator or the victim, but we're uncomfortable with something happening. And it's about providing consistent programming and ongoing dialogue with youth, with schools, and with youth agencies like Lighthouse and Cedars, the detention center. And I think the key to prevention is this ongoing dialogue of preventing these things from happening.
Mm-hmm. Now, I've been hearing the phrase rape culture a lot lately. What does this mean and what can be done about it?
Yeah, rape culture is a concept that's used to describe a culture in which rape and sexual violence is common. And we have these attitudes and these norms that tolerate sexual violence, that condone it, and I would say to a certain extent celebrate it. And so we've been hearing kind of national conversations about what rape culture is and what can we do to combat it. One example that I think of when I hear the word rape culture is the victim blaming that we have and how pervasive that is in our society. So it's, this mentality of asking the victim, well, what were you doing, or what were you wearing, or why were you at that party? And what happens is that shifts the spotlight from the perpetrator to the victim. And we know that it's never the victim's fault with these crimes, but we need that accountability from the perpetrator that's often missing. Another example of rape culture is that only 3% of rapists will ever spend a single day in jail. So if we're going to combat rape culture, it has to be done on an interpersonal kind of micro level when responding to victims and survivors, but there has to be institutional changes that happen as well. And we have to acknowledge its presence too. I think a lot of people out there say it doesn't exist, or they downplay the extent to which rape culture happens in our society. In fact, last year in the spring, there was this national conversation and people were kind of denying that it was happening, and the hashtag rape culture is win was trending on Twitter, and people were sharing everyday examples of rape culture that they saw within their personal lives, a lot of them related to victim blaming. So if we're going to combat it, we have to acknowledge it, and then we have to actively work against it. We have to talk about the victim blaming and the misconceptions head on so we can have more accurate conversations about sexual and relationship violence.
Very good. Now tell me about the hashtag I Am a Voice campaign.
Yes, so we officially launched the I Am a Voice campaign on April 23rd in recognition of our 40th anniversary. So Verizon Wireless generously donated funds to be able to have this prevention campaign widespread throughout the community and to publicize services. And so we officially kicked this off, and we're encouraging people to share their voices on social media, how they will use their voice in combating violence in our community and being that active bystander. So I brought some examples of the speech bubbles that we've been seeing popping up on social media. This is I Am a Voice that educates others, which we've been seeing a lot of students kind of sharing. Also, I Am a Voice that doesn't blame the victim. And it's been really inspiring to see all of these pictures and videos pop up on Twitter and Facebook and Instagram, and see how people are using their voice to end violence.
Great. Now how can somebody who's watching participate?
Yes, we hope that everyone will participate in this campaign and it'll spread like wildfire. If you go to our website, which is voicesofhopelincoln.org, and you click on the tab Get Involved, you can actually download this speech bubble, print it out, share how you'll use your voice, and then upload that image or that video to social media with the hashtag I Am a Voice. And you can see what others are doing as well.
Very good. All right, thank you both for being here, and it's a wonderful anniversary to be celebrating in our community. Thank you.
Thank you.
Thank you.
When we return, we'll learn about how to stay safe in the sun.